Dr. Adam Kassam is my guest today. He is the president of the OMA, the Ontario Medical Association. So if you know what's good for you, please press PayPal so you can see the rest of the show because it's important. Throughout the media, ever since the pandemic has started, people are reporting, the mainstream media is reporting, the number of cases discovered that day. And it goes up and people are terrified. It goes down, people are somewhat mollified. I'm told by other experts, though, that that really isn't the important indice.
Well, Stephen, what we really care about in our case numbers that are reported or the number of hospitalizations is healthcare capacity. And so what I really look at are the number of people in hospital, the number of people who are in hospital who are in the ICU, and the number of people who are in the hospital in the ICU who are intubated. And those are really surrogate measures for how we are doing in terms of being able to care for the people who need care. And so those numbers are really, really important. Case counts are important, but those
are important, but a lot of the case counts may not even require hospitalization. And so there's sick people, but they aren't deathly sick, necessarily.
Well, we're seeing this with the vaccines. As we're seeing vaccine numbers come up, we're seeing case counts come down. We know that the vaccines are safe. We know that they're effective. And ultimately, the whole point of the vaccine is to reduce the ability of this virus to create or cause significant disease. And that's really important because significant disease then requires a hospitalization. So if we can get that protection, that's what we really need.
So, I mean, we are in the summer now. We're recording this. My understanding is, from the non-mainstream news, but just from people who work in hospitals, that the number of incidents of people who are in intensive care has virtually dropped off.
It has gotten a lot better from our peaks from other waves. There's no question about that. One of the things that we do need to consider, however, right now is this potential for a fourth wave in the unvaccinated. So that's where this becomes a little bit of a challenge. We know it's still a race to get as many doses in arms, as many people fully vaccinated as possible, so that we avert any kind of fourth wave if we can. And hopefully, if we have enough people fully vaccinated, it won't overwhelm our healthcare system.
And since the very start of this, we have improved some of the capacity of our healthcare system. So if it does come and is oppressive, we will not be running around like Chicken Little, as some were at the start.
I really hope so, Stephen. I think that we have hopefully learned the lessons of the past 12 to 16 to 18 months, and hopefully we've applied that to the infrastructure of our healthcare system and ultimately be able to reach success, which is getting over COVID-19, making sure we're focusing on recovery, rehabilitation, and taking care of the people of Ontario.
I know why you were elected president now, because you were very political when you said, hopefully, we're over that. I think that is absolutely right, and I'm hopeful with you. Dr. Kassam, thank you very much. Almost 3 minutes. Justin Trudeau is traversing the country on a government jet, handing out your money for all kinds of projects. I'm sure they're all extraordinarily worthy. Why now? He wants your vote. He is trying to buy a bigger Liberal majority next time around. So, as we are one of the few news services which are not paid for by the government and by Justin, please support us. And thanks for watching.